Seals. I'm going to be a student nurse today, and we're going to be performing a head-to-toe assessment on you. I'm going to start by closing this door to provide some privacy. If you could tell me your first and last name and date of birth.
Eli Rochester, 1801.
Alright, I'm going to check your armband and make sure that's what I have in my chart. It is. We can begin the assessment with your head. Your head is non-cephalic and erect, and now I'm going to palpate it. Let me know if there's any tenderness.
No.
Okay. No tenderness upon palpation, and no lesions were present. Now I'm going to assess facial movements. I'm going to ask you to do a couple of things. Wrinkle your forehead for me. Okay. And shut your eyes closed real tight. Okay. Clench your teeth. Okay. Puff out your cheeks. And give me a smile. Alright, nice. Cranial nerves 5 and 7 are intact. Now if you could close your eyes again and hold out your hand. I'm going to give you something to taste. Tell me if it's sweet, salty, sour.
Sweet.
Okay. Cranial nerve 7 is intact. Patient was able to correctly identify candy as sweet. And now I'm going to palpate your sinuses. Okay. First your frontal and your maxillary. Was there any palpation? Any tenderness at all?
No.
Alright. No tenderness upon palpation. And now we can move on to the eyes. Okay. I'm going to hold this. You look down. Alright, now look up. Okay, conjunctiva is white in both eyes, and there is no crusting or discharge bilaterally. And conjunctiva is pink bilaterally as well. Now I'm going to perform the diagnostic positions test. Just focus on my fingers and try to move with them, okay? Okay, cranial nerves 3, 4, and 6 are intact, and there was no nystagmus present bilaterally. Okay, now I'm going to measure your pupils with this pen light. Okay. Alright. Pupils were 7 millimeters bilaterally, and if you could just stare straight ahead for me. Okay, pupils constricted bilaterally, and now if you could just focus on this wall behind me. Okay, and now focus on the tip of this pen light. Alright. Pupils are equal, round, reactive to light, and accommodation, which means that cranial nerves 2 and 3 are intact. And now, I'm going to look at my cards real quick. Okay, alright, next in our assessment we can do the red reflex, so I'll just stare straight ahead. Okay, this side. Alright. Red reflex was present and symmetric in both eyes. Now we can move on to the next part of our assessment, the ears. They are equal in size bilaterally, and I'm going to palpate. Let me know if there's any tenderness.
No.
Okay, no tenderness upon palpation. And now I'm going to do the whisper test. I'm going to whisper 3 words to you, and you just let me know what I said. First, can I get you to cover your left ear? Okay.
A12.
Alright, now we'll do this other side.
B34.
Okay. Cranial nerve 8 is intact. And now I'm going to do the Weber test. I'm going to use this tuning fork. I'm going to hit it and I'm going to put it at the center of your head. You just let me know if you hear the sound equally in both ears or more on one side than the other.
Equal.
Okay. Sound was heard equally in both ears, no lateralization to either side. And now I'm going to look inside of your ears. I'm going to start with the left ear. I'm going to pull it up and back. Ear canal is patent. Tympanic membrane is intact. Pearly gray in color. Translucent. Shiny. And the cone of light is at 7 o'clock. Okay. Let's look at this other one. The right ear. The ear canal is patent. Tympanic membrane is intact. Pearly gray, translucent in color, shiny, and the red reflex is at 5 o'clock. Okay. Now we can move on to your nose and mouth. Okay, your nose is midline with no swelling present. Can you occlude one nostril and sniff up? Okay, now do the other. Okay, canals are patent. And now can you close your eyes, occlude one nostril, and sniff up and tell me what this smell is?
Alcohol.
Alright, now let's do another one.
And same alcohol.
Okay. Cranial nerve 1 is intact. Patient was able to correctly identify the smell of alcohol. And now let's move to your mouth. Okay. Alright, open wide. Okay. Hard and soft palate as well as the buccal mucosa is pink and moist. The posterior pharynx is pink and moist. The the tonsils are graded at 2+. The tongue is pink and rough. The uvula is pink and midline. The frenulum under the tongue is midline and intact. And as far as dentition goes, all teeth are present and there is no sign of dental caries at all. Okay, now I'm going to assess for tongue movement. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, cranial nerve 12 is intact. Tongue movement was smooth and symmetrical. Alright, so next can I get you to open your mouth and say ah? Ah. Okay. The tongue protruded all the way out in a smooth symmetrical motion. So cranial nerve 12 is intact. And gag reflex was also tested when you said ah. And uvula arose midline. And so cranial nerves 9 and 10 are also intact. Okay, so I'm going to look at my cards again. Okay. And can you swallow for me? Alright, there are no impairments in swallowing, and now we can move on to the next part of our assessment, the neck. Okay, so I'm going to first palpate your trachea, and you let me know if there's any tenderness.
No.
Okay. Trachea is midline and symmetric, and there was no tenderness upon palpation. Now I'm going to assess your lymph nodes. So we're going to start with the pre-auricular, posterior auricular, occipital, and submental, submandibular, tonsillar, superficial cervical, posterior cervical, deep cervical, and supraclavicular. Was there any tenderness at all?
No.
Okay, no tenderness upon palpation, and lymph nodes were non-palpable. Okay, now I'm going to palpate your carotids for the pulse. Okay. All right. Pulse was graded at 2+ in the carotids bilaterally, and now I'm going to auscultate. Alright, so I need you to breathe in and then breathe out and hold it, okay? Okay. Okay, perfect. No bruises were detected. Now we can move on to the next part of our assessment, the skin. Okay. Skin, the color and pigmentation is consistent throughout the body and appropriate for the ethnicity. And now I'm going to palpate what I'm going to assess for temperature. Okay. Okay. Temperature is consistent throughout the body. Skin is dry and warm, and there are no lesions present. Skin is intact and very smooth. Alright, so now I'm going to assess for skin trigger. So I'm just going to do that right here. Okay. There was no tinting present, and skin recoil was almost immediate. Okay, next, can I get you to turn to your side? Okay, AP to transverse ratio is 1:2, and now I'm gonna assess for your oh yes, they're right there. Assess for your chest expansion. So just give me a deep inhale, exhale. Okay. All right. Chest expansion was smooth, unlabored, and there were no accessory muscles used. And now I'm going to do lung sounds. So, all right, give me a deep breath in and out. Out through your mouth. Okay. Okay. All right. Okay, turn to the side. Okay. All right. Okay. Okay. Lung sounds were heard clearly with no adventition sounds anteriorly or posteriorly. Okay, and now we can do your heart sounds. Heart sounds. This is the aortic. This is in the right, second right inner space. And now the pulmonic, the second left inner space. Okay. We'll do the tricuspid. And lastly, the mitral. Okay. Sounds S1 and S2 were heard, and there were no murmurs present. And now I'm going to do your pulses. So if you can hold your arms out for me. I'll do your brachials first. Okay, yeah. And your radial. And now your posterior tibialis. And dorsalis pedis. Okay. Pulses were graded at 2+, bilaterally in your upper and lower extremities. And I'm going to look at my cards. Okay. Next, we're gonna do the capillary refill. So hold that. Okay. All right. Capillary refill was less than 2 seconds, bilaterally in both extremities, and upper and lower extremities. And now we can move on to the next part of our assessment, your abdomen. So if you could just lay back for me and lift your shirt up. Okay. The abdomen is flat and smooth, no lesions present. Okay, and now I'm going to auscultate, starting in the right lower quadrant. Okay. Normal active bowel sounds present in all 4 quadrants, and now I'm going to percuss. Okay, tympany was heard upon percussion in all 4 quadrants, and now I'm going to do some light palpation and then some deep palpation. Just let me know if there's any tenderness at all.
No.
Alright, you can sit back up. No tenderness upon palpation, light or deep palpation, and there were also no masses or lumps as well. Okay, so next in our assessment, move on to the musculoskeletal. We're gonna do the range of motion of your neck first. So if you could look down for me. Okay, now look up. Alright, now to the side, to the other side. Okay, now rotate. Okay, perfect, perfect, perfect. Okay, now could you stand up for me? And hold your arms out. Extend it, flex, extend, flex, extend. Alright, now supinate, pronate, supinate, pronate. Okay, full range of motion in the neck and arms so far. And now for the legs, bend one at the knee and then extend it. Okay, now do the other. Okay, and lastly, the spine. Try to bend all the way down and touch your toes. Okay, and now do lateral. Okay, and now go to the back. Alright, perfect. Okay, full range of motion in the spine as well as the arms and the legs. Okay, you can sit back down now. Okay, now we're going to test muscle strength. So if you could grab my hands, okay, and my thumbs. Okay, I try to push my hands up. Alright, I push down. Okay, muscle strength is graded at 5+ in the hands. And now let's try your legs, feet. Okay, push back. Alright. Muscle strength is also graded at 5+ in the lower extremities as well. Okay, now finally we're going to do your shoulders. We're going to do a shoulder shrug. Okay. Muscle strength is graded at 5+ bilaterally as well, and cranial nerve 11 is intact. Now we can move on to the final part of our assessment, neuro. We're going to do 2 cerebellar tests. So if you could stand back up for me, please, and have your hands at your side and close your eyes. Okay, as a negative Romberg test, you were able to maintain balance, and now we're going to do tandem walking. So you just stand one foot in front of the other in a straight line. Okay, now let's do the other way. Okay, good. Cerebellar function is intact. You were able to walk in a straight line. And now we're going to move on to a coordination test. So if you could, for me, hold your arms out again like this and close your eyes. And using your pointer fingers, one at a time, touch your nose. And then simultaneously try to do it as fast as you can. Okay, perfect. Coordination is intact, and now we can move on to some sensory tests. I'm going to break my tongue blade in half, kinda in half. Okay. I get you close your eyes and tell me whenever you feel a dull sensation or one that is like pricking or something that you feel pain. Okay.
Dull.
Okay.
Sharp.
Okay.
Sharp. Dull. Sharp. Sharp.
Okay. All right. Now we're gonna move on to the next sensory test. All right. Can you close your eyes again?
Mm.
All right. And I'm gonna hand you an object and tell me what it is. Okay.
Oh, a battery.
Okay.
A pin.
Okay. All right, and that checked for stereognosis, and I believe that was the last test in our assessment. Thank you, and have a nice day.